Shiriki, equity, please.
Yes, thank you. So my job is to highlight the equity issues. You might start by thinking, do these solutions work for the socially disadvantaged communities that we've been hearing about all day? We now have a clear commitment to equity. It's part of the NAM mission. We've heard about equity from Dr. Chan. I just have a couple of quotations from her ECHO report on ending childhood obesity. We know that inequities occur within countries, across countries. We heard from Bill Dietz about what some of the inequities are within the United States, including the fact that some of the success we're seeing could be associated with widening the gaps and creating inequities. So think about how we can get these solutions to work in communities of color, low-income communities, and there are other actually populations with disparities in obesity that have disadvantages in their circumstances. So this is our reference point, a NAM report from 2012, Accelerating Progress on Obesity Prevention, and there are 2 points to make from this slide. If you look at the top part, you see a framework with a Venn diagram that outlines the key settings in which we have to take action. And you've heard about different interventions in these settings. So the school environment, you may not be able to read in the box, but the schools and very important environments for action on obesity. Work sites and healthcare environments, sort of captive audiences, and then the other environments in communities to the left and the right where influences on the options people have for eating and physical activity are present. And surrounding this is the message environment. And by that we mean the commercial marketing, the advertising and promotion, and nutrition education and social marketing. The messages are all there together, but they are overwhelmingly dominated. This is undeniable. Overwhelmingly dominated by commercial marketing of unhealthy products. So the bottom of the slide reminds us that there are people in these settings and that the settings are not a level playing field, that people have different starting points, and those starting points for environmental change and responding to those changes are affected by race, ethnicity, gender, socioeconomic status, historical context. So the report acknowledged, had recommendations that we think are beginning to work and show success, but they acknowledged that not all environments are equal. And the question is, what are we going to do about that? I have on this slide some examples of a breakdown of different types of environments, physical, economic, and social cultural. Some people go right to the social cultural when they think about ethnic groups and low-income groups. It's the bad behavior and so forth. I think we know now, because so many people are affected by these environmental factors, that it's physical, access, environments, cues in the environment, economic factors that are the big players, and in some cases, in the different cultural groups, it could be that the culture is increasing the salience of some of these cues. You know, if you come from a place where you could never have that, when it comes there and it's cheap and you can get it and it smells delicious, you may want too much of it because of that deprivation. But in general, we're talking about the physical and economic environments that we're trying to change. So I have this slide and the next slide are ending on a positive note, because I think that we already know what we can do to achieve equity in the ability to reach a healthy weight and maintain that. There's a body of work that's emerged since 2012, since that Accelerating Progress report came out, where people have begun to ask the question, well, when we look at different strategies, are some of them really better for people in disadvantaged social circumstances? Are some worse? Or are some neutral? Do they work equally well? So instead of thinking about solutions that we assume will work well, universal solutions, they're going to affect everybody. Yes, they're going to affect everybody in some way, but how much are they going to affect them? And if they affect those who can have and can take advantage of them, then they might widen gaps. So the things that are listed here, what's coming out of this literature of comparing interventions for their effects by socioeconomic status, and using theoretical models to think what's required for an intervention to work. So one of the things that seems to work is selecting or designing your intervention while thinking about what does it take for you to benefit from this? What kind of capacity do you need in the community to make that intervention work? What resources do people need? I think everybody agrees that these interventions have to be multi-component, multi-disciplinary, multi-sector. You've seen that in that Venn diagram that I showed you. Those things are working together in those environments, not just picking one. Whole community approaches with community engagement, not top-down, but involving the community. This concept of proportionate universality is this impact according to need. So applying the solutions with universal goals, but applying them differently in a more focused and intentional way in the communities that need more, that have farther to go. And this explicit consideration of equity, this intentionality seems to help. Not just it happened by accident and oh wow, that worked well in the low-income population, but we started off looking at the things that would work well in the low-income population. So here's my last slide. It's an evolving framework that came out of some discussions in the roundtable on obesity solutions here at the Academy. And the point is that in the settings, there are also 4 types of processes that have to take place. We're trying to increase healthy options, that's in the green, and we're trying to reduce deterrence to the healthy behavior, that's in the red. That's what you've been hearing about. Those are the things we do best. That's in our lane. If you go to the bottom and we get out of our lane and try to improve social and economic resources, this is essential. We cannot address any health problem that is embedded in the social fabric as social disadvantage if we just keep ignoring the social disadvantage. We can't do a workaround. So we need to go find those other policies for housing, for jobs, and things that are suggested here, education policies, and integrate them with our interventions. And in the 4th quadrant, build community capacity, we have to add to the health promotion, the marketing and things that increase agency, action orientation, entrepreneurship, not just the nonprofit that's going to give you the food, but the way you can become an entrepreneur, and strategic partnerships. So the scales of justice in the middle really say that if we designed our programs, a package of interventions, picking from each quadrant and integrating things that will complement each other, we can get to equity. We just have to get out of our lane and reach out to social determinants so that we are not asking people to be healthy when they have no life and no home to live in. Thank you.
Great, thank you.
Thank you.